The ear is made up of three parts. The outer ear includes the part you can see and the canal that leads to the eardrum. The middle ear is separated from the outer ear by the eardrum and contains tiny bones that amplify sound. The inner ear is where sounds are translated to electrical pulses and sent directly to the brain. The commonly used term ear infection is known medically as acute otitis media, or a sudden infection in the middle ear, which is the space behind the eardrum. Anyone can get an ear infection, children as well as adults, although ear infections are one of the most common reasons why young children visit healthcare providers. The ear is connected to the back of the nose via the eustachian tube. This tube equalizes air pressure inside the ear and funnels secretions from the middle ear into the throat. The walls of the eustachian tube lie flat against each other to prevent the migration of bacteria or other germs into the ear from the nose and throat. If the eustachian tube is blocked, secretions and associated bacteria build up inside the middle ear. This can cause ear infections, mild deafness, and an increased likelihood of a ruptured eardrum. Ear infections occur most commonly in young children because they have short and narrow eustachian tubes. About 80% of children develop an acute ear infection at some point. Symptoms of an ear infection include ear pain or discomfort. This symptom is obvious in older children and adults, but in infants too young to speak, look for signs of pain like rubbing or tugging of the ears, crying more than usual, trouble sleeping or acting fussy and irritable. Some other symptoms to look out for is a fever. Ear infections can cause temperatures up to 104 degrees Fahrenheit. Some 50% of children will have a fever associated with an ear infection. You want to look out for drainage of the ear. Look for either yellow, brown, or white fluid that is not earwax. Another symptom is trouble hearing. Fluid behind the eardrum slows down movement of electrical signals throughout the inner ear bones. So how are ear infections diagnosed? A healthcare professional will consider your symptoms and examine your ears with an instrument called an otoscope that has a light and magnifying lens. The examination may reveal redness or air bubbles or pus-like fluid inside the middle ear, fluid draining from the middle ear, a perforation in the eardrum, or bulging or collapsed eardrum. So how are ear infections treated? While most mild ear infections clear up without any intervention, the following treatments can also help. You can apply a warm cloth compress to the affected ear. Take over-the-counter pain medications such as Tylenol or Advil. Use over-the-counter or prescription ear drops to relieve pain. Take over-the-counter decongestants like Sudafed, and avoid sleeping on the affected ear. If your symptoms get worse or don't improve, see a healthcare provider. They may prescribe antibiotics if your ear infection is bacterial, chronic, or doesn't appear to be improving. For adults, it's a good idea to visit a doctor if your symptoms last longer than 2 or 3 days, or you have severe pain or a fever. Ear infections are most common in children. It's important to see a doctor if you or your child develops severe pain, a fever over 102.2, ear drainage, or other concerning symptoms. But most importantly, do not delay care. If you think you or your child has a suspected ear infection, talk with a healthcare provider today.